I can, just by
Hi,
the luck
Heather.
of the draw. Hi, Sarah. Nice to meet you.
Nice to meet you too.
So we are actually live on Facebook just as you showed up. So magic.
Perfect.
Yay!
Perfect timing.
So there's a little bit of a delay before I introduce the moms, but delay. So as we're talking, hopefully we won't talk over each other. So there's a lot to talk about.
There is.
Just be wary. So hello, moms from MomsPumpHere. This is Priya, and we have a fantastic live discussion today, an important live with Dr. Lee from Bundu and Heather Shore from Nourish Collection. And today we're talking about healthcare. And this is such an important topic because it's like a hot button right now. A lot of people are discussing all these politics and policies. So I thought it was important to really talk about what happens to the people directly, the moms and the children that are affected by everything that's been being discussed and created for us for our healthcare. And it was important to have two amazing moms on that were both passionate about this topic. Now, Dr. Sara Connolly, she is a board-certified pediatrician from the American Academy of Pediatrics, and she's fantastic. She's also the medical director for Bundu Health. And Bundu is this amazing platform full of tons of health and wellness information for moms, lots of articles. They've been one of our partners since we've started, and I always refer back to their content to reference information because it's so factual and so informative for moms. So definitely check them out after our discussion, and I'll put a link in the comments. And we also have on Heather Shore, and she's a fantastic mom and entrepreneur, and she's a very active citizen. She's advocate for breastfeeding and for I wrote this down, Heather. I want to make sure I get it right. Parental leave legislation.
Absolutely.
Absolutely. And we've known Heather for a while. You're welcome. And Heather's one of my Facebook buddies, and we talk a lot. So I thought she'd be great to involve in this conversation as a mom as well. So let's start with Dr. Connolly. Dr. Connolly, would you like to add a little bit to our introduction real quick?
So healthcare has obviously been in the forefront the last several weeks, right? I think you'd have to be living under a rock to not understand that healthcare in the United States is a big, big deal, right? But when we're talking about it in the pediatrics standpoint and in the mom standpoint, what we're really focused on, right, is access to care for moms and babies specifically. And so that obviously is my area of expertise. And, access to care means different things to different people. But what we're trying to get people to think about is that healthy mamas have healthy babies, except sometimes they don't, right? So sometimes the best laid plans aren't what we expect. And so in the pediatric world, it would be our pie in the sky wish that any child at any point could have access to health care. And in the United States, in general, with kids, we actually do a pretty good job if you compare us globally. If you compare us to some of the other industrialized nations, maybe not so much. So that's why our perspective sometimes is a little different than if you take healthcare in its entirety, because we are sort of focused on this younger age group and our moms, of course. So for us, we're talking about prenatal all the way through, I don't know, what does childhood end these days? 30, 31? I don't know.
Old, I think.
Later than it used to.
26
Right.
Yeah. So Heather, would you like to add a little bit to your intro as well about the importance of healthcare for you?
Oh, I think, healthcare permeates all of our lives and we're all affected by it. So this is, between healthcare and taxes, it's some of the most complicated institutions that we have in this country and certainly around the world. And, I don't think any of us can escape that. So we're all affected. It just depends on how. And none of us have, a crystal ball. with regard to what we're going to look forward to. So I think we need to, look at expectations and things that don't, that happen that we're not expecting, like Sara was talking about. Yeah, it's critical, and especially right now where we're looking at health outcomes of moms and really trying to prop up, infant health care, drive down our mortality rates. We've done an exceptional job. Why stop now?
Yeah, that's absolutely true. We're talking about making investments wisely, right? So when we talk about healthcare from a general pediatric standpoint in particular, we're focused on preventative medicine. I mean, essentially, we're preventative medicine specialists if we're doing our job well. And so sometimes you hear about programs being cut that, I don't know, to the average person might seem unnecessary. Early childhood intervention and things like early, pre-K readiness and something as simple as nutrition standards for schools. But that's where your quarter invested pays off in the long run. And so sometimes it's hard, I think, to see that when you're not actively a parent at that stage of your life, because it doesn't seem like it relates to you, but it so does, because it really speaks to the health of our entire nation. And so these things are really, really, really important to us as pediatricians, and something we focus on, certainly at Bundu too. Part of our goal is to offer families not just advice to do when things aren't going well, but advice to do so that things continue to go as well as possible. So it's a complicated discussion that pediatricians and moms and families and just about everybody has sort of jumped into lately. And I think that's really great, because it adds to the understanding of everyone when you hear different perspectives of why healthcare is important to you.
Absolutely. So let's dive right straight into that question, Dr. Connolly.
Okay.
So why is healthcare so important to you and your family? Let's get a little bit personal.
Okay.
We get into all the big facts.
Definitely.
Why is it important to you personally?
For me as a mom, it's peace of mind, right? It's peace of mind. It's so that I, do my due diligence and my kids go to bed on time and they eat a healthy breakfast in the morning and they wear their seatbelts in the cars, and they do all the things that are they're supposed to do. And then in the afternoon, they're on the soccer field and oops, someone falls and an arm is clearly broken, right? The last thing I want to think about is, oh no, I'm not going to be able to pay my mortgage this month. Or even, oh no, where do I go? Right? Healthcare is important because it allows me to know when things go awry, that I know what to do and where to go. So that's important, not only for the access of care, but as an informed parent as well. And so when a mom or a woman is considering starting a family, or a couple are considering starting a family, or have been placed in the position where they're going to start a family, we'd like them to think about, what do they want their healthcare to look like for them? How easy do they want it to be? And where do they envision themselves going in times of trouble? And how do they envision, that would impact their day-to-day life, if that makes sense.
Yeah, that's hugely important. We have to think about what's going to happen day to day with our kids and our family. What about you, Heather? How has healthcare impacted you personally?
Well, it's actually impacted me really personally pretty recently. This is something actually, Priya, I don't know that you know. I actually gave birth last year in March to a babe who was stillborn. And she had what was trisomy 18. So this is my daughter.
Hi, baby.
So she, this is Alexa.
Hi, Alexa.
So
welcome.
Thank you. So she was, we didn't know what was going on until later in the pregnancy. And what really made a huge difference for us was the care that we received, and knowing that we didn't have to go from care provider to care provider. They were communicating. It was a team. They worked with me, and it was, for something that was so critically devastating to find out, and then she passed away in utero. To have that
Oh
be
my God,
something that
Heather.
wasn't completely crushing.
Mm-hmm.
That's why this stuff is important, right?
So you had felt like you had a support net ready for you. Not that it was going to be easier or easy, but hopefully you had people to catch you as that very difficult thing happened.
I did, and not everybody does, and that made a critical difference. Absolutely.
Wow. So, what do you think of these policies that are being created? We have all these major things that are happening. And Heather, I'm so sorry. We're Facebook friends, and I didn't even realize that happened to you. I don't know if you posted about it or shared it, but I'm sending my love. I know it's only been a year, but I'm sending my love. So these policies that are being created by our local and our federal governments, all our platforms that all three of us come from are bipartisan platforms. So it was important to have this discussion today just to lay out facts and share information about what happens to us personally as moms and to our children. But what happens when policies come into the home? Dr. Connolly, what do you think about that?
Well, it impacts decision making. It's interesting. So I'll give you an example. I have had in the past, patients who's maybe had a chronic illness, and back several years ago, you might remember there was this concept of an insurance cap, right? So in a lifetime, you were insurable up to X number of dollars. And usually it was a very extraordinary amount of money for the average person, right? It was $1 million or $2 million. But the fact of the matter was these families were reaching these caps. They exist and they reach. So for example, you could very easily reach a arbitrary cap if your little one is a graduate of the neonatal intensive care unit. You can very easily reach a cap if your spouse has had a devastating car accident that left them with ongoing neurologic issues that required therapy. You can very easily reach this cap. And so some of these families would say to me, gosh, we'd really like to have another baby, but we just can't. We can't, we don't know that we'll be insured. I am now considered, quote, high risk. And so the cost to insure me through my next pregnancy is really going to impact the size of our family, right? And that's amazing. And I don't think that's really what anyone intends it to do. But again, when you're starting with me, when you're starting prenatally and you're going from the first, 2 cells of a child's life all the way through adulthood, over time, these caps become an issue. Over time, pre-existing condition labels become an issue. And what we want is our successful young people with diabetes or, who had survived childhood cancer or had a devastating motor vehicle accident as a little one and now has prosthetic limbs, to be allowed to reach their full potential without this economic elephant in the room as they go forward, So it does affect people. Every day it affects people, It affects how people make decisions about their own finances, if they buy a home versus renting a home, how they save money for the future, because if they feel like it's vulnerable in one area, they may choose to invest differently because they're worried about their healthcare costs being forcing to be paid, by something that they were saving for the future of retirement. So to think that people live in this bubble where they don't pay attention to healthcare costs or they don't pay attention to the potential for catastrophic illness impacting them, I think is really just not true. None of us go through life, or I could say none of us, most of us don't go through life thinking it'll never happen to me. which I think is sold to us a lot. Most of us do go through life thinking it could happen to me. And so
Yep.
be prepared. And if it did, what would happen? And those are hard questions. I think, if we do have solutions to some of those questions. And so that's where evidence and economic research really can help us, because it can really show us where our investments are going to pay off over time. So, we're wise to listen to people who spend their lives studying healthcare and healthcare policy, and because they give us some decent advice. It might not be perfect advice, because this is unbelievably complex, as Heather mentioned. And it may vary depending on who you are and even where you live in the country. So I think that gets very tricky too, because our needs can vary from place to place. As you know, we were talking about, you're in New York City. The cost of raising a child there is a little bit different than the cost in rural Pennsylvania. And, so those things vary. So there is not a one fits all approach to this, which is, I think, part of the problem when you're getting into federal policy that everyone gets kind of tied up in.
Yeah, absolutely. So Heather happens to be from Minnesota. We didn't share that before.
But we're in the Midwest here.
Yeah, different part of the country. So Heather, what are your thoughts on this, living in Minnesota?
I think when we talk about the cost of healthcare, and we're talking about how healthcare is kind of transforming and how much we need it, we are kind of looking at this value-based healthcare. So it is changing based on individual needs, and I think that's actually why we need this kind of new solution to, certainly a new solution to where we get funding for healthcare, but not gutting it. This isn't a solution. So with regard to Minnesota, we have amazing facilities here. We have the Mayo Clinic here. We have, some of the most innovative health tech companies are based here. And so we're kind of in the thick of it here. We hear a lot of language around innovation and just healthcare costs. I think we're also a very practical state. And we've kind of laid out with regard to cost of living and the number of people here who need healthcare. We're not one of those states that's in dire need with regard to percent to total. Like, we're not a very high risk state when you look at it apples to apples, when you look at it across the board from, state to state. But we're still, everybody is affected by it. So, when a state that has done relatively well and is relatively well funded has this crisis, that it's a serious issue across the U.S.
Absolutely. So we did touch upon a little bit of options going to be, and we talked about conditions that women already have, children already have, what you went through, Heather, things that we cannot control, that end up falling into this category of pre-existing conditions. And it's right now, it's a hot button and it's been on my brain, and mostly the conditions that directly affect women. And as of, not to get too political, but as of late, some policies and some there's been a lot of conversations, I think, around pre-existing conditions and our latest policies not covering it. But I wanted to put to rest this myth, because the new healthcare bill that just came out does cover these pre-existing policies. But what I think people are lumping it into saying that it doesn't is because it's allowing insurance to hike up premiums on these pre-existing conditions, which eventually people can't afford. And
and there's a difference. Yeah, you can afford a Mercedes-Benz, but it's cost prohibitive for most people.
Exactly. So
the option
it's not
is
like
not.
So it's not like the premiums are hiked up. And I wanted to read off a short list of the conditions, and then I want to hear your thoughts, both your perspective as a doctor and as a mom. I want to hear your thoughts on this. So on a short list, I listed the conditions that directly affect women while they're pregnant. And there's more: obesity, diabetes, cancer, stroke, high cholesterol, asthma. And then there was pregnancy, postpartum depression, and C-section. And those three, the really like were in my face, like discussion about this. This families, our households, the core of the nation, all these families across the country that rely on health insurance to cover those. So I want to hear your perspective on that. Dr. Connolly?
Right. So, this is tricky, right? The way insurance is supposed to work is that we all chip in, and that basically if we're all chipping in, then the money that is being contributed by those lucky enough to not have a pre-existing condition can help, therefore, then offset those, unfortunate souls that do have a pre-existing condition. Okay. So the problem comes in when we're starting to talk about darn near everything as a pre-existing condition. Okay. So people have been saying, well, it seems like being a woman is a pre-existing condition. And truth be told, it's not. However, it certainly seems like being a fertile woman may be a pre-existing condition, because if you're going to include the fact that you've had a C-section, which the last time I checked was the discretion of the obstetrician and not the mother, then that's a tough one. Again, here you go, rolling it into, well, gosh, I've had one C-section and now we'd like to get pregnant again. And so my husband or my significant other, my partner, is about to change jobs, and we're gonna buy new insurance. And in the new insurance, if I include maternity care in my new insurance in the anticipation that we'd like to have another baby, oh my goodness, it's 4 times higher than it would have been if we didn't include maternity coverage. And that was pretty typical just a few years ago, right? When you bought insurance, you decided, am I going to buy insurance with maternity coverage or without maternity coverage?
Absolutely.
And, a wise group of people sort of said, well, half of us are actually women, and a certain number of those women are going to continue our species. And so maybe we should go ahead and just cover maternity coverage. And obviously, as a pediatrician, I'm completely biased and for that. I think that we need to celebrate women and nurture our society by supporting them when they were planning to become pregnant and then becoming pregnant and then after they're pregnant. And so it's, I think, disheartening that some of these, quote, pre-existing conditions could, impact the family in that way.
Absolutely. Absolutely. And Heather, how do you feel about that as a mom?
I think to Sarah's point, I was nodding a lot because I think that people absolutely make decisions based on what they can afford, and they look forward to it. And some people don't, but most people do. And the at the end of the day, regardless of whether, you're for women or not, we're going to have other people are going to be pregnant, right? We need that, because if we don't, we're just going to die off. This is a very practical thing. It's the one thing we can always rely on, right? We're going to have more babies, hopefully. So I think that's a base need. And to put pregnancy and the reality is those costs are higher. They have always been higher, but with this amortization that has happened in the last 7 years, we've been able to offset some of that for the greater good, really. But to penalize moms who are working, who have to pay for their own insurance, or their families pay for their own insurance, or it really does penalize them. If you're looking at hiking up the coverages, and people are entering the workforce more and more. We looked at, even in 2008, there was a kind of a mass layoff of a lot of men. And what are we going to do in that situation? Just not have children? these are core decisions in people's lives. So this is not something to take lightly. It's not even something that people who aren't parents can't pay attention to. This affects us all.
Absolutely. And you said something in the beginning there of your statement. You said, oh, women. So I think that's a broader issue in this whole conversation, that women need to be included in these conversations, medically, personally, politically, from both sides. They're both relevant discussions, and people need to come together on them. And so I want to take a step back. So we're talking about healthcare and covering these pre-existing conditions, things that happen to you that are out of your control. But what about self-care? Where does self-care come into play? Dr. Connolly, I know you work directly with, children and moms. When does that conversation happen for self-care? And how important it is for self-care? When is the conversation for self-care come into play, and how important is it for the families that you have this discussion?
Well, self-care is huge. It's huge, and I think that's one of the reasons why websites like Bundu are so important, and the Wellness Network is so important. We have really entered a time where we're trying to, as much as we can, empower our patients. Okay, so we want them to come to the medical office, to come to the emergency room with a certain basic level of knowledge about their self-care and health maintenance and things like that. And if they do, it really aids us as physicians. It helps drive down the cost of caring for people if they understand when they're ill, where to seek medical attention, when they're ill, to understand how ill they might be, right? So I'll give a very super common example is if you have a beautiful, firstborn baby, and that baby at age 6 months has their very first fever, and everyone with a baby at 6 months old with their first fever, if they all run into the emergency room, then across the board, right, it's an understandable response, number one. But number two, it's actually not usually the appropriate response, right? So self-care and your basic level of medical education and how that plays into that is really important, because if we have a mom who is clear-headed, who is getting enough rest, who's getting enough nutrition, whose baby is the same, who has had access to care, they don't run to the emergency room. They take a deep breath. They call me on the phone and they say, Dr. Connolly, the baby has a fever. What do I do? And we talk about it. And the healthcare dollars, if you're talking about the economics of it, drop immediately, because we're not wasting money because we've set this person up in a bad scenario. But if a mom and a family is not able to do the appropriate amount of self-care, if they're living in chaos, if they don't have enough food, if the lights aren't on in their house to be able to read the thermometer, if it's cold, if they're unsafe, then they're gonna flock to that emergency room every single time. And so that self-care, that lack of care, that lack of being in a really empowered position to care for themselves or their child impacts them tremendously. And so that's one of our goals in Bundu. And that's why when you go on our website, we're going to talk about fever, and we're going to talk about shots, and we're going to talk about all kinds of things, but we're also going to talk about nutrition, how to begin feeding your infant, what to do, how to spot those baby blues, how to spot postpartum anxiety, what to do if you have a question in the middle of the night, who are the people in your doctor's office and how do they interact and help you, who should you call when XYZ happens. It's all part of that, empowering these families to take a big breath and say, I got this. I'm in control. I feel happy and healthy. I can provide for these children. So I cannot overemphasize how important self-care is for young families. It's tremendously important.
And Heather, what has self-care? Go ahead. Go ahead. No, go ahead. Go finish your thought.
So, and what Sara was saying, I think when we look at what is in place right now, there's a lot of preventative stuff that's in place right now. And that's what we benefit from, right? That's what the ACA was structured on. It's really preventative care, working with your doctors as a team, being informed. If we take away some of those preventative things, we always end up paying more later, and then our general health goes down. But self-care and healthcare have to be part and parcel of each other. They can't be separate things. They have to be supported. And that's something that probably, and Sara, you can speak more to that, but more of the medical community around us in Minnesota has been talking a lot about just partnering with patients and getting them informed and kind of an FAQ of information so that people have those baseline pieces of information themselves. They can be active participants. And that's part of why, what we have in place right now is so important, because there's so much education. Education is key.
Absolutely. Absolutely. To the end of this book, but before we go, there's a lot of information for our moms. How can our moms, if they want to find out more information about self-care or health?
I lost you.
Connolly?
I lost you.
Sorry.
Like, what did you say?
You cut out just for a second.
How can moms find you when they have questions about self-care and healthcare?
Oh, you can find me all the time. We are available to you all of the time. So bundu.com, they can log on, they can interact with one of our communities and interact with other moms who have a lot of information to share. They can read our A to Z articles about everything under the sun. They can comment on any article they read and say, Dr. Connolly, I have one more question. Can you answer this question? And we will respond back to them. They can ask a doctor privately if they choose to ask a private question, and we're delighted and thrilled when they do. They can say to us, hey, I want to know about this, and it's not on your site, and we will have an article up and ready for them as soon as we possibly can. We love our young families, and and that includes moms from conception through early childhood. So no question is off limits. We want to hear from moms.
That's awesome. And there's also a number, right? There's a number on your website. Is it still available for moms to call?
Not a phone call number, but there is an Ask the Doctor service where if a mom decides to ask a more detailed personal question to myself or to the OBGYNs that work with us, it goes through our website and it's a private one-on-one question that we can respond to.
Perfect. So that's a great tool that moms have available instead of like going to their pediatrician or running to the urgent care. Well, I'm sure if it's an emergency, they should go to the urgent care.
Right, of
but
course.
there's a tool online they can go to.
Absolutely.
And get all the information that they need.
Right. And we do a lot of,
Heather,
of self-care. Yeah.
Absolutely. So Heather, how can moms reach out to you if they want to get in touch with you and, talk to you about what you've experienced?
Sure. They can reach out to me at Nourish Collection. We're on Facebook, and they can go to the page and message me, and either myself or one other person actually directly answers those questions. So, and looks at incoming messages. So I just want to say I am such a fan of you both. Now it's so good to meet you, Sara. I think you're doing that. What great resources you have. And Priya, you're doing amazing things. So I'm so proud to be a part of, your community.
Oh, thank you. Well, thank you both for joining us today. This was a wonderful discussion. I hope you both share this, comment on your Facebook pages. And if moms, again, if they get in touch in the comments, so moms can just click on it. Check out both Heather Shore and her Nourish Collection and Bundu and Dr. Connolly for any medical or health questions or mommy questions you may have, because they're both fantastic moms. Mm-hmm. Absolutely. Absolutely. And don't forget to check out MomsPumpHere.com. Download our app to find places to breastfeed and breast pump around the world. And check out our new product, Just Add Breast Milk. Thank you all.
Thank you.
Love you all.
Thank you.